is on our side. Our God's got everything we need. We got everything we need. Thank you, Lord.
I hope you enjoyed the sounds of Grammy-nominated singer Jason Claiborne and friends. You'll hear more from them coming up. Welcome to Norton West Louisville Hospital, a place where healing, health, and hope come together. My name is C.J. Ramsey. I'm in the 7th grade at Hudson Middle School, and I am proud to call West Louisville home. I am proud to have this new facility in my neighborhood to help care for kids like me. I am also proud that my dad is one of the first employees of this new hospital, the first hospital to be built west of 9th Street in more than 150 years. You are in store for a great ceremony today to celebrate the upcoming opening.
Welcome to Norton West Louisville Hospital. If you don't get goosebumps, check your pulse. But we have people here to help you if you need help. Norton West Louisville Hospital. It's time. It's time. It's a place, it's a facility that was built at 28th and Broadway. It's a building that was built at 28th and Broadway in Louisville, Kentucky. But it's a place that forever will exist at the intersection of health and hope. It's a place that needs to remind us all it's time. It's time for something different. It's time for a change. It's time for a renewal. It's time. There hasn't been a hospital built west of 9th Street in Louisville, Kentucky in over 150 years. On Monday morning, when those doors go open, that's no longer true. It's time. When those doors go open on Monday morning at 8 o'clock, a new chapter gets written. A new chapter that has words about collaboration, about listening to a community, about not telling a community what you're going to get, but listening to what you want and then delivering on it. It's a chapter about rebuilding something we let get away from us in healthcare. Trust. It's time. Say it with me. You can do better. I like that part of it. Thank you all. So, I like to think about intersections and corners. Let's turn the corner as a community. Let's turn that corner where your zip code is no longer more relevant than your genetic code. It's time. You can say it. It's time. It's time where when you grow up in this community, your life expectancy is the same no matter where you live. It's time. You know, it wasn't that long ago, it seems like it, 3 years ago, we were at the African American Heritage Center, and we were telling you about a dream. We were telling you about a hospital that we wanted to build. We were telling you about a partnership. But what we also told you that day, it's not enough just to build a hospital. We have to build a hospital the right way. We told you that we were going to go in the community, we were going to listen, we were going to figure out what was needed, we were going to respond to it, and you were going to be able to see it in the design, in the services, and in the general feel. And we did that. Probably more importantly, we told you that it had to be built right from an inclusion standpoint. We told you that we had to make it available for anybody who wanted to be a part of it, anybody who wanted to be part of the process of building this new dream, this new hope. We wanted to make it inclusive to people who'd been marginalized in the past, perhaps because their organization wasn't big enough, wasn't sophisticated enough to get in other projects. We said, no, we're going to make a way for you to participate in this. And that's exactly what we did. It's time for our community to realize that when you are intentional about inclusion, it can happen. It's time. We also told you that we were going to take a very intentional approach to making it not just goals and not just aspirations, that we were going to make it an imperative to do it the right way. It's time that in our community, we all make it an imperative to build great things the right way. It's time. Say it with me. We're getting better. It's really important that we celebrate the people who built this hospital today. It's so important that you know the hands, but more importantly, the hearts of the people who came here for 3 years and realized that they were building a hospital, but they were building something way more important. They were building something that was going to lead to change. They were building something that was going to change a narrative. They were building something that would benefit an entire community. They were building something that they could take their kids, their grandkids to and say, I was part of that. They put their heart and soul into this building on an everyday basis. It's time that we recognize that wonderful group of people who built Norton West Louisville Hospital. Say it with me, it's time. So we also found out partnerships really do help. And I'm going to talk a little bit about one that really we need to celebrate. It's time to celebrate it. Our Urban Workforce Development Initiative, a partnership with Harmon Messer and the Louisville Urban League, that gave opportunity to young West Louisvillians to get a career, to learn a trade, to understand how life works, to get to understand the importance of what you do. That program graduated young men and women that gave all to Norton West Louisville Hospital, but more importantly, it created a future workforce of individuals who will be able to participate in the many great projects that our community will have going forward and be able to help do it in a way that's very inclusive. It's time that we celebrate those graduates from that UDI program. It's time that we celebrate everybody who had anything to do with building Norton West Louisville Hospital. Say it with me, it's time. They built a great place. But we have to come up with a better model to care for people, and that's what we've done. What we're telling you now is our goal, our wishes, our desires for you is to help you find a path to wellness and not a hospital bed. If we do our job well, you can live a better life and not have to spend time in our hospital. But understand, we want to be there. We want this hospital to be there when you need that care. We want it to be a permanent place. We want it to be a place that you can depend on. We want to be a place that builds a relationship, and it's permanent. Too often, in underserved areas, we've said the answer is to roll in mobile vans. Not here. No wheels on Norton West Louisville Hospital. It's here. It's going to be here. And guess what? That Norton Healthcare mailbox that Dr. Cosby told me we better plant in concrete if we were serious about this is now planted. Our mailbox is planted in concrete right here at 28th and Broadway. It's time. It's absolutely time for that. I mentioned partnerships. What we know for sure is that any organization in this city can do good things. We can. Others can. But what we found out is that when we work together, we can do great things. We can really experience the exponential power of partnership. If it weren't for Goodwill, we're not standing here today. They graciously welcomed us. It's time to thank Goodwill. Thank you, Goodwill. And what's happened? So many other things have happened since we started together. We look forward to the partnership with Dare to Care. All of a sudden, we're going to be able to do things that help everyone live a better life beyond just health care. That's really what our responsibility is as stewards in this community, is to have it completely help people live a better life. And that's what we're doing. So that partnership piece of this becomes very important. And finally, I want to tell you that we stand on the shoulders of heroes who are way before us. tell you that I personally understand the importance of history. If you look at the monument wall where you walk into this facility, what you see are the stories of black physicians, black nurses, black clinicians who took the risk to care for people of color west of 9th Street when it was not permitted. When you're willing to step up during that time, you're the hero. We need to always remember the sacrifice. What it really means to have a commitment to service is written on that wall at 28th and Garland. That's the philosophy that we must have going forward. And when the days get tough, when people are telling us what we can't, what we shouldn't, and why we shouldn't, and that it can't be done, and that it's never been done, walk out to that wall. Read what's on that wall and understand it's time. You know, those heroes do exist. They are no longer with us. However, there's a lot of people who've been doing great work in West Louisville way before we got here. That's important that we celebrate today those people as well. Family health centers, a legacy of care in underserved areas, providing great care. We appreciate them. Shawnee Christian Clinic, great care, 4 years. We appreciate them. And so many independent physicians and clinicians who've hung their own shingle and gone out on their own risk to make certain that services were provided for people in West Louisville. It's time that we remember the heroes that are on that wall, but it's also time that we celebrate those people who've been doing it for the last few years. Please join me in a round of applause for both of those groups of people. It's time. You can probably see a little theme in what I'm saying, but it's time. It's time to provide more access to West Louisville to healthcare. It's time to improve health outcomes. It's definitely time for us to work partnerships in a better way. It's definitely time that those children at Brandeis Elementary on that playground today look out at this hospital and say, I now have the opportunity to live a healthy life, just like every other child in all parts of the community. It's time for that. It's time for those elderly people who are living at 28th and Dayton, who don't have hope and don't have a place to go, to understand that we're here to meet your health care needs, but we're here if you're lonely. Come by, visit with us. We're a place that wants to make life better for you. It's time that we remove disparities of health care. It's time that we obliterate the inequities. It is absolutely time that this facility leveled the playing field for health care in Louisville, Kentucky. It's time. Stand up and say it with me. You don't know how much I appreciate you being here today. And you don't know how much I appreciate my family being here today. I had no idea that my sons were going to be here today. Thank you, Kathy, Christian, and Will. My heart's full for you being here. Well, we have to let some other people talk now, I guess. We're so fortunate to have a board of trustees and a foundation board that supports us in doing these things. I'm going to ask them to stand, those who are members of our board of trustees and our foundation board, and receive a round of applause for the wonderful work that you do. Please stand, our members of our board. Thank you all. Now, our board of trustees chair, Edie Nixon, might have been more passionate about this project than even I was. So she may say it's time a few times up here, I think. She's been there since the very beginning. She was here for the groundbreaking. She was here for the topping off. She was here for the block party. She's been here every step of the way. Edie, thank you so much for your leadership. Thank you for putting up with me. And thank you for what you've done for this community. Please join me in welcoming Edie Nixon.
All right, I'm not quite sure how I can follow that one, but it's time. So we want to get moving on, and thank you, Russ. It has been a passion of ours, and we've been a great team together. And thank you all for being here. Yes, it is time we open this hospital, and I'm so honored to represent the Norton Healthcare Board of Trustees as we celebrate this historic day. Today, we celebrate all that the project symbolizes: inclusion, hope, and access. When there is access to healthcare, there is access to hope. Lives are changed when health issues can be addressed right away and close to home. And communities change when organizations like Norton Healthcare and Goodwill Industries behind us form partnerships to address the needs of the community. I also would like to take a moment to recognize and thank the Norton Healthcare Foundation and Norton Children's Foundation as the individuals who believe in the project that inspired them to generously donate to it. From the historical monument there on the corner to the rooms, the furniture, the artwork inside the hospital. We could not have done this without that support, and we are so appreciative. And now it's time to introduce Brian Wilson, the chaplain of the West Louisville Hospital, who will provide a blessing on this beautiful day.
While I stand here as a representative of our thriving faith community, I do recognize all of the faith leaders who are here with us today. Many of you have worked with us over the last 2 years, and we appreciate your commitment to the hospital. Will you please stand? All the faith leaders, thank you all. Now I will ask everyone, please join me in this offering as we ask God's blessing upon Norton West Louisville Hospital. God, we are filled with joy to embrace this beautiful, sacred moment in the life of our community. Through the centuries, soil was cultivated, seeds were planted and watered, as so many known and unknown have toiled under various elements in the seasons of their lives to bring about the hope realized for us all today. You called them to the work then, us to the work now. We recognize Norton West Louisville Hospital is your work within and through us, and it is marvelous in our eyes. We also trust this is only part of what you will continue to do to bring about health and wholeness to all. From the moment the thought of Norton West Louisville Hospital entered the mind, to the flame it ignited within the heart, and affirming words of support took on the form of engaged action, you have been with us. From the breaking of ground to the very completion of the hospital, your blessings to overcome the challenges have been with us. Now, as we open the doors of Norton West Louisville Hospital to the community, we ask your continued presence and blessings as we commit our hearts and hands in the spirit of love and unity to provide excellent care to all who come to our hospital. Amen.
Folks, let's give it up for the leadership of Russ Cox in helping to make this happen. And I know we're going to hear from her in a little bit, but this lady's an absolute hero who's changing the world. How about Corinza Townsend and all her work? And how lucky are we as a Commonwealth to have Jason Claiborne? My goodness. Folks, I am so excited to be here today. Since I became your governor, we've had some tough days and we've had some great days. This is one of the best days I've had as governor of Kentucky. What an amazing day. We're so excited today that we are all here. We have our First Lady and my partner in everything I do, Brittany Bashir. We also have our Lieutenant Governor, Jacqueline Coleman, our Educator-in-Chief. I am here excited for West Louisville. I'm here excited for all of Louisville. And I am here excited for the entire Commonwealth of Kentucky. It was a little over 3 years ago that I did get that call from Russ. He did want me to get up awfully early. But what he didn't tell you is for the year before, for that very difficult pandemic, I called him time and time and time again. And I had asked him to do things, and Norton to do things, that in any other time in history would have seemed crazy. And every single time, he and all of the nurses, doctors, and everyone else who works in this system answered the call, said yes. Let's thank all of our healthcare heroes for getting us through that pandemic. And I still remember about the first 2 sentences that came out of his mouth, and I think my words were, "Amen." This is such an opportunity. I think about the American dream that starts with opportunity but then has to end in prosperity. And opportunity is so much about access. It's about access to education. It's about access to employment. And it's about access to health care. As Dr. King said, one of the major inequities that plague our country. But I think about some announcements that we have all had together over this past year. On access to education, I want to thank JCPS and Dr. Polio for announcing the new middle school that's coming up just blocks from here. On access to employment, I think about Goodwill and the several hundred jobs that are there. Norton West Louisville Hospital, which just told me they've already hired over 380 people already. And then next Friday, we're going to cut the ribbon and open Stellar Snacks, a $170 million investment in this community, another 350 jobs, folks, in a 6-month period. Together, we'll have announced 1,000 new jobs in West Louisville. And now today, we are celebrating access to health care, such a critical part of making all of our lives, but especially the lives of those who live in the neighborhood surrounding this amazing hospital, that much better. I remember the announcement 2 years ago when Norton Healthcare and Goodwill announced their historic collaboration. This year, we're seeing it become a reality. Oh, the announcements are the hope. The groundbreakings or the beam placements are the progress. But the ribbon cuttings, they're the reality. It means the jobs are here, the services are here. On Monday, people are going to walk through these doors and have access to the most advanced, newest hospital in the entire Commonwealth of Kentucky right here. You've heard it, this is the first hospital in West Louisville in 150 years, meaning it was too long coming. But I love the fact that the dollars that were put in, the thought that was put in, that this area got the very best. It's going to employ over 380 people all working together to help the patients who walk through these doors. In addition to medical care, folks can get all types of services, from a new bank account to a haircut to a cup of coffee. Families in West Louisville have waited for this moment for far too long. I'll never be able to fully understand the pain of discrimination, of racism, that have led to 150 years without a hospital, without that direct access to this type of medical care. But I'll promise you what I've promised before. I will listen, and I will try to hear. And with partners like Norton and Goodwill, we will take intentional steps to move forward together. Thank you. Some days it's good being the governor. But like all parents, Brittany and I know what this means to the parents of CJ. My goodness, what a great job he did. I think future Governor CJ over here. We know what happens when one of our children are sick. Every minute feels like an eternity, and the idea that you might have to take your child on 2 buses to get to see a doctor, that if you have to have an ambulance ride, could take that much longer now. Families in West Louisville can get their children the care that much quicker, that many fewer minutes, that much less worry. This is what doing good things is all about. People can come here for help during emergencies, and they can also visit outpatient medical clinics in the same building for their checkups and the screenings that they need. Just think about how many lives will be saved because of this facility. Just think about how many lives will be bettered because of this facility. Just think about how many more years people will live and get to spend time with their families because of this facility. You're not just changing lives, you're saving lives, you're elongating lives, and you are making them so much better. You are helping people to live out their dreams. So I want to thank the teams that helped build this game-changing facility, Harmon Construction and Messer Construction. Thanks for getting it up and going. And while I love the team that built it, I really love the team that's going to staff it. This building is ready to open, but it's the healthcare heroes, the doctors, the nurses, and the support staff that'll truly bring it to life. If you're going to work in this building, raise your hand, and we're going to give you a big round of applause for all your work. Carenza, you've put together an amazing team. And her delivery of healthcare is so important. You know, I believe in my core that healthcare is a basic human right. And so this hospital, working with so many other steps, are going to help us do more and to be better as a Commonwealth. It's why we relaunched Connect and expanded Medicaid. Remember, from now to January 15th, Kentuckians can sign up on Connect to get that health care coverage. It's why we capped the cost of insulin, because no one should ever have to choose between paying for their insulin and putting food on their table. It's thanks to so many people that are here that we're one of the only states in the entire country that can say we've seen our drug overdose deaths go down 2 years in a row. Thank you to everybody working in treatment and in recovery. It's why we're working so hard to bring clean water to every Kentuckian, helping to replace the Patty's Run flood pump station to reduce the risk of flooding to 63,000 people that live in West Louisville. It's why we relaunched the 988 Mental Health Lifeline. Remember, it's okay to not be okay. And we all have some difficult days. That number is there for you to call, and somebody is on the other line that cares for you, that loves you, and is specifically trained to help you. And it's why we're bringing high-speed, affordable internet to every single home and every single business across Kentucky. We're going to get it done while I'm still governor. Well, like I've promised every day that I've been governor, our job is to bring prosperity to every corner of Kentucky, to bring access to that opportunity. And today does my heart good, because it means that we are delivering. But the ideas and the demand came from this community. The leaders of this community that are with us today, whether from their pulpits or from their offices, that have fought for a facility like this. Let's thank all our community leaders who pushed so long to make sure this happened. And I promise to you that I will continue to be that leader that listens and that tries to move us in the right direction. For days like this with major investments, or that day we removed the Jefferson Davis statue from our Capitol so that everybody can feel welcome walking into that rotunda. To this year, when the General Assembly wouldn't act, so I used my executive authority to declare Juneteenth a state holiday in the Commonwealth of Kentucky, to doing what we could in the executive branch to make sure that no one ever faces discrimination in their employment because of their hairstyle, making sure that that Crown Act at least applies to the 30,000 state government jobs. Yeah, I've been reminded just about every day that I've been governor that life's short. That was during the pandemic, during the tornadoes, during the flooding. It was also during the loss of a number of people I love, Folks, J. Michael Brown would have loved to be here today, and I know he is looking over us so proud of everybody's work. But all that's taught me that life is short. Our job is to be kind to each other and to do good things. That is exactly what we're seeing here today. Thank you for putting your trust in me as your governor. I'm going to be your governor for another 3 years and 1 week. And I promise you, we're going to be back, celebrating other accomplishments, celebrating more access, celebrating not just opportunity, but actual prosperity. When we do these things together, we move forward together. And I'm excited to work every single day to make sure we have another event like this, and another one after it, and another one after that. 1,000 jobs over 6 months is a good start, but I know we've got a lot more work to do. And my promise is there's a lot more coming. God bless. Thank you all very much.
We welcome you back anytime, Governor. The Governor introduced Lieutenant Governor Jackie Coleman, who is a fellow teacher of mine, and I want to make sure that you stand up and get that recognition. Us teachers stick together. We have so many other elected officials with us here today. Would you please stand if you are an elected official in our presence today, and let us recognize you. Thank you so much for your service. I'll have to tell you a quick story. I toured this facility with Congressman McGarvey last week. He's the only person I ever toured with that smiled the entire time. The entire time. What he had in his heart is what comes out in his words, that he truly does believe that healthcare is one of those things that is a right. It is not a privilege, and he constantly champions that in Washington. Congressman, you're welcome here anytime to work the front desk with that smile. Please join me in welcoming Congressman Morgan McGarvey.
Good morning, everybody. This is truly an awesome day. I mean, what a thing to be standing here. Russ, thank you so much for your kind words. You are going to receive so many accolades that you have earned and you deserve throughout the course of this day. But after that speech, let me first start off by thanking you for not running against me for Congress. Out of self-interest, I'll just go ahead and say it's never time. Otherwise, I think I will find myself working the front desk with nothing but a smile there for everybody. This is truly amazing. Thank you to our governor, our Lieutenant Governor Jacqueline Coleman, to Mayor Greenberg, to all of the dignitaries, to all of the community leaders, the faith leaders, the Norton team, and the staff. This is an amazing moment. For those of us from Louisville, think back 5 years ago. If you were here, there was nothing. It was a desert. No buildings, no infrastructure, no services, no hope. And the pandemic hit. And while many of us fought for and hoped for change, I think even this was beyond some of our dreams. But then we were here a couple of years ago, and the shovels in the dirt got turned. I don't know about you, but even though I was excited, I didn't want to get my hopes up too much. This wouldn't be the first time in West Louisville somebody turned a shovel in some dirt, but it didn't finish a building. Look at this. Russ, as our current president would say, this is a big effing deal. Okay, that's not exactly what he said. Close enough, Andy? Yeah, all right, close enough. But I really could not be more excited for this moment. As Russ said, I had the opportunity to tour this facility a few weeks ago, and what I saw is truly nothing short of amazing. It's the most insightful, compassionate effort I think our city has seen in generations. Because a building, like a community, only works when it is built from the bottom up, not the top down. And what this building is it's a space entirely informed by the needs and desires of the community it was built to serve. Art that reflects the vibrancy and culture of West Louisville. Huge windows allowing tons of light, a cafe where people can feel welcome, and even though there are local things here, they got a Starbucks, right? Not because they needed a Starbucks, but because everywhere else has one. And if it's good enough there, it's good enough here too. There's green space. There's places for patients to recover. There's places for families to heal. You walk through this, and Russ, you said it, I could not stop smiling because I felt lifted. Around every corner and every wing you enter, you don't just see the amazing facilities, the first-rate technology, the thought put into every single detail. What you see is a team of truly caring, mission-oriented professionals. Doctors, nurses, staff, attendants, custodians, people who are also smiling right back at you because they know what they are a part of. They know what they are building. And I think most importantly, they know why they are doing it. There's a lot of positivity today. And in that positivity, we must acknowledge our healthcare system is deeply unequal. Here in West Louisville alone, life expectancy is 15 years lower than it is in other parts of our city. This is an appalling consequence of intentional policies based in the worst parts of human nature. Racism, greed, apathy. We must acknowledge these truths. In the 1960s, Reverend Dr. Martin Luther King said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Russ Cox, the team, the board at Norton Healthcare, they recognized this injustice, but they didn't just talk about it. In my faith, love is not a feeling. Love is what you do. And they did something about it. They acted. And this hospital will forever be a living monument to their determination to right these wrongs. What they built, it's not just a hospital. It is a mission. It is opportunity. It is services. It is hope. It is a rallying cry to our city, our state, and our country. We all can rise when we don't leave anyone behind. When we are brave, when we listen to people, when we serve people, when we create true community, places of immense hope, places and opportunities where people everywhere can get the care we have come to know and expect from Norton Healthcare. I know this continues to be a team effort. Thank you so much to every single person at Norton Healthcare who has brought this to life. The governor mentioned her, but I want to give her another shout out. There is one person, though, I want to make sure that she gets her flowers today as well, and that is Corinza Townsend. To know her is to love her. Her spirit is infectious. But more than that, she's a doer, right? She is a doer. You want her in your foxhole. Corinza, I'm a music fan. I was watching the Rock and Roll Hall of Fame induction ceremonies a few years ago, and I think it was Patti Smith who said, you die 3 times in life. You die the day that you actually stop breathing. You die the day they put you in the ground. And you die the last time anybody ever says your name. You're going to be immortal in Louisville because of what you have done here at Norton Hospital.
It's hard to be more positive about Norton West Louisville than I am. Unless maybe you're Mayor Craig Greenberg. who constantly has kept me motivated to continue doing these things. He recognized right away that a city block could change a city. Right here, 28th and Broadway. He's challenged us with what's next. That's what good mayors do. They stay after you to continue to do great things. He loves this city. He loves West Louisville. Most of all, he loves Norton Healthcare. Please join me in welcoming Mayor Craig Greenberg.
Thank you so much, Russ. Thanks to Carenza. Thanks to everyone who's part of the Norton Healthcare team for making this amazing project a reality that we're here to celebrate, but also for what you've done in the years past in our city, for serving so many patients, for serving so many families, for investing in the Louisville Sports and Learning Center, for investing in our LouMed district. Whether it's downtown, whether it's West Louisville, Norton Healthcare is an amazing corporate citizen that has invested in our city, that has transformed the neighborhoods in which it serves, and that has been a part of such important community transformation, just like we're seeing right here at 28th and Broadway, along with goodwill. As you just heard, just think about what this was a few years ago, and now where we're headed, where we are going from disinvestment to reinvestment. And so today is definitely an amazing celebration, a celebration to thank everyone who made this project a reality, a celebration to think about the families that are going to get such great care, that are going to have more services here in West Louisville. And so we should be celebrating today. But I also want to issue a challenge to everyone here today, a challenge to everyone else who is part of our community. And that challenge is, look at this place. Look at the success that can happen when we work together in partnership. The private sector, the public sector, the nonprofit community, all working together to support folks in our community. So think about what else can be done. Russ is a man of great ideas, great commitment, great focus, great leadership. Channel your inner Russ. What are your ideas? What can you help make a reality? And let us know. Let Governor Beshear and his administration know. Let me and my administration know. Let Congressman McGarvey know how he can help at the federal government. We have colleagues today from all across our city representing you on Metro Council here today. Let them know. We want to partner with you because West Louisville deserves the best. And now it's starting to get the best. We've got the best new park in the entire city of Louisville, just a few blocks away at Alberta Jones Park. As you heard and you've seen, we've got the best new hospital in all of Kentucky right here at Norton West Louisville Hospital. What else can we continue to invest in? We need to help Vincent James and Dare to Care make this vacant property across the street the best facility in all of not just West Louisville, but all of in this state to serve more people who are hungry and need more access to food. We need to build more retail stores, more coffee stores, more restaurants, more fitness centers, more homes of all kinds here in West Louisville. We can do that together because we've accomplished it here. We've accomplished it here on the corner of 28th and Broadway, and we can accomplish it everywhere else in every other neighborhood of West Louisville. So friends, I'm incredibly excited to celebrate with you here today. But I'm so even more excited about the momentum that this project shows, that the other projects that have come to fruition show, that the groundbreaking next week, as Governor Beshear mentioned at Stellar Snacks, will show. Let's continue to capitalize on this momentum. Let's continue to work in partnership. Let's continue to work in partnership to invest right here in West Louisville, to continue to make West Louisville and all of Louisville safer, stronger, and as Norton Healthcare is doing, healthier as well. Thank you, Russ. Thank you, Carenza. Thank you, everyone at Norton Healthcare. And I'm so excited to keep working with you all. Take care.
Mayor, I think my family would be a little concerned about channeling too much of that inner Russ. We won't talk about that. I told you about the meeting that I had with Governor Beshear. 5 days later, I called Anthony Mathis, who works in our construction and design area. And I asked him if he'd like to have lunch. He wondered what the heck I wanted, but he didn't say that. We met for lunch in the Pavilion cafeteria downtown. I sat across from him and said, Anthony, you're the third person that I've told this to, but you're the most important, because we're thinking about building a hospital in West Louisville. And I want to know if you want to be part of this. He looked squarely across the table and said, whatever you need, I'm in. And that has been the attitude that Anthony Mathis has brought to this project, because we challenged Anthony. Remember what I said about building it right. We said, Anthony, we cannot build a new old hospital, and we cannot build a hospital the way that it's been built and with the people that have built it in the past. I challenged him. He answered the challenge every step of the way. And you have a facility that is a national model for inclusion. You have a facility that is a national model for workforce development. It's time for you to meet Anthony Mathis.
From an old, dilapidated brownfield site to a campus for health, wellness, and opportunity, this hospital is no longer a hope, a want, or need. This hospital is now a reality. It's a high honor, a distinct privilege as a Louisvillian, a Kentuckian, and as an African American to walk you through how we built this hospital and the team that got us here. And I'm going to start off with our architectural team of Moody Nolan and Carrie Anderson. Moody Nolan, 2019 AIA Architect of the Year, and this is why. This is the type of work that they do. And Carrie Anderson, the first registered Black architect in the state of Kentucky, part of this project as well. And then our CM team of Harmon Messer. And Harmon, with ties to West Louisville, and Billy Harmon played basketball for the University of Louisville. And then you had Messer. Messer has been a trusted partner for Norton Healthcare over the past decade, and we can always count on Messer, and they came through once again. Our community inclusion team of 7 p.m., 1 West, and NTC. They have been absolutely amazing, and they were part of the reason that we maximized our participation on this project. Thank you. And then I have to say thank you to Adam Lewis and our project management team. They've been amazing as well, coupled with Tina Ballard and Karen Koch behind the scenes. Amazing. Thank you. Now, these are the things that you can see. You can see the facility right now, but I really want to take you through some things that you just can't see. Like at the beginning of this project, we had our complete design and construction team, about 29 of the members, and we all got in a circle. And I posed a question to each one of them, and I said, give me one word that sums up what this facility means to you or means to the community. And transformational, impactful, generational, life-changing, catalyst, now. Those were just some of the words that came out throughout the circle. And what you can't see is Russ and Corinza and Renee canvassing this community, trying to understand what was needed for this hospital and what services were going to be put in this hospital. They amassed over 4,500 surveys to help them get a heartbeat on this community. And what you can't see are the cultural deposits that Cindy and her team have laid throughout this community to get us prepared. And what you can't see is Lenny Meyer and the foundation, their hard work and their dedication to also get us here today. And what you can't see is Andy McCarthy, our VP, just constantly asking, well, what would it take when we ran into barriers on construction? And what you can't see is the transformational wave that this project has already started. We had a worker that worked on this project, and he said, he's on the construction team, and he said, this project hasn't changed my life. Being a part of this construction team has saved my life. That's what we're talking about. And I tell you, before we did any work and before the construction began, before we turned any dirt, I was very clear on establishing, noting, stating, reiterating, and discussing that this was not going to be business as usual. We were going to maximize minority participation, and maximize participation we did. We blew the industry standard out of the water. 37% minority participation, and we spent over $23 million with minority contractors. Our workforce, 49% minority and female workforce, built this building. Unprecedented and unheard of. Doesn't happen in our industry. 80% of the companies that built this building from Kentuckiana. And though our design is complete and our construction obviously is done, the vision is just beginning. But here's the thing. Health equity is ensuring that everyone has the opportunity to experience the highest level of healthcare regardless of their race, religion, zip code, financial status. So what we cannot, must not, and will not do is underutilize this hospital. This hospital will combat the inequities in healthcare with the urgency of now, right now. This hospital will break barriers, bridge gaps, and create a place for health and wellness. And they say a rising tide lifts all the boats in the marina. Well, this hospital will be that rising tide to lift this community to generational health.
As a proud Army veteran, retired, I am honored to share my journey as a patient of Norton Healthcare. My journey began over 25 years ago when studying clinical pastoral education, otherwise known as CPE, at Norton, completing 4 units of CPE and serving 2 chaplain residencies and my first assignment in labor and delivery. It was intense, but it has been memorable. Then in 2017, I had to have emergent open heart surgery. The trained hands of Norton's staff cared for me through my mending journey, the process even through cardiac rehab. While at cardiac rehab, I was then selected from the staff to represent Norton's Hospital as a woman's heart champion, completing the training in Minnesota. Then providing education for Norton cardiac patients upon return. Currently, my primary care physician remains with Norton Hospital Healthcare Systems. I am so grateful that Norton West Louisville Hospital is close to my home. It comes to my neighborhood at an exceptional time, and opening on Veterans Day, like you say, Russ, opening on Veterans Day, well, I believe that speaks volumes of hope for the future of the various generations, ethnicities, families, the veterans, and myself living in this community. This opening is a yes, a yes, a yes, a yes for the community. It says that you care about the people, that you honor the residents, that you see your duty to join in community, to provide quality health care here for us. So I challenge the community, my community, this community, the Norton West Louisville Hospital, and my neighbors. And the challenge is this: keep it clean and friendly. Yeah. Keep it compassionate and fruitful. Yes. And keep it competitive so that it will be fruitful and fluid for the future more than 150 years from now.
Such a historic and monumentous day, such a historic and monumentous building. First and foremost, if you work at West Louisville Hospital, please raise your hand. Everybody look around. Keep your hands up. If you have worked on, in, or been a part of this project, raise your hand. So that roaring of an applause that you just gave me, please give it to these folks. Standing ovation and all. This is who we're celebrating today. Not Carenza, maybe a little bit of Russ. These are the folks that trusted me, the people that are standing with me, behind me, around me, the folks that have been praying for me, praying over me, the folks that have stood in front of me, behind me, next to me, people who have represented me when I wasn't in the room, people who have defended me when I wasn't in the room. These are the people that we're celebrating, not me. Yeah. So first and foremost, if I say nothing else at this podium, it is a huge thank you to that team and those folks. So our good chaplain Brian made a comment earlier when he was praying about the nature and the growth and planting seeds. I heard an analogy the other day, and no, I did not prepare a speech because I just would have fumbled all over it. I heard an analogy the other day that said that your wisdom is not your gift. Your wisdom is not yours to give. And so in honor of that, thinking through trees, you think a tree needs light, a tree needs water, a tree needs less than what it gives. The tree bears the fruit for the person that walks past. The tree bears the fruit for the people and the animals that are going to feed from it. We are the tree. Our gift, our wisdom is not for us. And so as I stand up here, and everybody said all the things before me, we've talked about this being the first hospital west of 9th Street in 150 years. We talked about equity. We talked about access. We talked about inclusion and all the things that we need to be doing. I need you to hear from me that all that I've done and all the people who raised their hand have done is not for us. It is for our community. And thank you, TT. So as we open the doors on 11/11, when we see our first patient Monday, and as we leave here today, I need everybody here to remember and to understand that your gift is not for you. And so to be selfless in your actions and understand that when we move forward from this, and as we open the doors and everybody goes home and everybody moves on, that not only do we have an awesome, amazing team that is ready to serve with those smiling faces like Congressman McGarvey and his lovely smile. But they will be there and they'll be ready to greet you. But my ask of you is that you go forth, and as my team hears me say, go forth and do great things, but that you take what you've heard here and all that you've seen and heard us do, and you go and disseminate that out into the community. Your gift is for our community, not just West Louisville, but Louisville at large, and for the rest of the world, because why have limits? And so as Renee Murphy always says, there's no limit to what our care can do. There's no limit to what our dreams and what our wisdom and what our gifts can do for other people. So just take that and go with you. Another thing is everybody always asks, Carenza, what's next? First, let's get this place open. But what's next is really good patient care and great customer service. That's what's next. Let's perfect that first. And then Russ will have another mysterious idea, and he'll talk to the board, and then he'll say, hey, Carenza, let's do this. And I'll say, of course, let's go and do it. But 11/11, Monday, is when, for a lot of us, the real work begins. We've had construction workers and those teams, and Anthony and all of those folks who have built us a beautiful facility. And Brian, who has prayed over this facility, and all of our faith leaders who have prayed over us. Let's do this, y'all. This is what this was built for. This is what we were built for. I just ask y'all continue to pray over this team. And as Miss Brenda said, keep it clean, keep it nice, keep a smile. We're ready. We're here.
3, 2, 1.